Do you feel exhausted after 8 hours of good night's sleep? Do you have any kind of tingling, numbness sensation, maybe in your arms, maybe in your legs? Are you becoming more forgetful, mentally foggy, or unsteady while walking? Many people blame those symptoms on aging, stress, poor circulation, or lack of sleep. But sometimes the hidden cause is deficiency of one essential nutrient, vitamin B12. Vitamin B12 deficiency can develop silently over several years because the body stores a significant amount in the liver. When those reserves finally become depleted, the symptoms may appear gradually and can easily be mistaken for another condition. The greatest danger is that vitamin B12 deficiency does not affect only your energy. It can also damage your nerves, interfere with your balance, and cause memory and concentration problems. And some people develop neurological symptoms even before routine blood tests reveal obvious anemia. My name is Mario. I'm European medical expert. For the last 26 years, I'm working with the patients, and one of my core specialty is going to be nutrition and natural remedies in correlation and combination in modern medicine. In today's video, I will explain everything that you need to know about vitamin B12. Why your body needs vitamin B12? Vitamin B12, also known as a cobalamin, is a water-soluble vitamin required for several essential processes in human body. It helps your bone marrow produce normal red blood cells, and those cells carry oxygen from the lungs to every organ, muscle, and the tissue. Vitamin B12 is also required for DNA production and normal cell division, but one of its most important roles is protecting the nervous system. And your nerves are surrounded by a protective layer called myelin. You can think of myelin as an insulation around the electrical wire. It allows nerve signaling to travel rapidly and accurately between the brain, spinal cord, muscles, and the skin. And when vitamin B12 levels becomes too low, this protective covering can be damaged. This is why deficiency may cause tingling, numbness, burning sensation, poor balance, weakness, and cognitive changes. In the next part of the video, I'm going to explain what are the main symptoms that you have vitamin B12 deficiency, and of course at the end of the video I'm going to explain everything that you need to know about dosage, side effects, and how to use vitamin B12. The first warning sign is extreme fatigue. The most common warning signs, of course, is persistent fatigue. People often describe feeling drained, weak, sleepy, and unable to complete activities that were previously easy. Vitamin B12 deficiency can cause the bone marrow to produce unusually large and poorly functioning red blood cells. And this condition is known as megaloblastic anemia. When the blood cells cannot carry oxygen efficiently, the muscles and the organs receive less oxygen than they needed. You may become tired after walking short distances, climbing stairs, or performing ordinary household tasks. And you may also notice dizziness, shortness of breath, headaches, pale skin, or heart palpitation. And one of the most common signs, as I said earlier, is going to be damage your nerves. And when you damage your nerves in your arms, in your legs, maybe in your spinal cord, around your spine, of course, you will going to feel numbness, tingling kind of sensation, like some kind of electricity go over your body. Some people describe pins and needles, burning feet, electrical shocks, reduced sensation, or feeling that they are wearing invisible socks or gloves. And those symptoms occur because vitamin B12 deficiency can damage peripheral nerves and their protective myelin layer. And the symptoms often begin in the feet because the longest nerves are usually affected first. As the deficiency progresses, a person may have difficulty sensing where the feet are positioned. Walking can become unsteady, particularly in darkness or uneven ground, and some people start stumbling, losing balance, or falling more frequently. Muscle weakness may also develop, making it harder to rise from the chair, climbing the stairs, or carry shopping bags. If you didn't notice already, this is my new channel that is called MarioLab Natural Remedies. This channel is focused only on natural remedies, minerals, and vitamins. For the last 7 years, I did already make over 10,000 videos on Andrew's channel, but this channel is going to be specific for those natural remedies and minerals and vitamins. Subscribe to my new channel for everyday information like this and many others. Next symptom is going to be memory loss, brain fog, and the mood changes. Vitamin B12 deficiency may cause difficulty concentrating, slower thinking, poor short memory, confusion, irritability, low mood, or what many people describe as a brain fog. In other adults, those symptoms may sometimes be mistaken for dementia. This doesn't mean that vitamin B12 is a cure for Alzheimer's disease or every memory disorder, but deficiency is one of potentially reversible causes that should be considered during medical evaluation. And some people also notice depression, anxiety, changes in personality, or loss of motivation. And those symptoms can have many different causes. So taking vitamin B12 blindly is not a substitute for professional assessment. Additional signs may include sore or red smooth tongue, mouth ulcers, loss of appetite, digestive discomfort, and unexplained weight loss. In more advanced cases, the skin may look pale or slightly yellow because abnormal red blood cells are broken down more rapidly. And in this last part of the video, I'm going to explain what are normal daily doses that I recommend to my patients, that is scientifically proven, side effects, and everything that you need to know about using everyday vitamin B12. Vitamin B12 is commonly available as a tablets, capsules, sublingual lozenges, liquid drops, oral sprays, and injections. It is not normally taken as a tea because vitamin B12 is a nutrient rather than medicinal herb. The most common supplemental form are cyanocobalamin and methylcobalamin. Hydroxycobalamin is frequently used for injections in some countries. Despite aggressive marketing, methylcobalamin is not automatically the best choice for every person. Cobalamin and cyanocobalamin is stable, widely studied, and effective for many people. The correct form depends on the cause of severity or deficiency, absorption, availability, and advice of healthcare professionals. For diet-related deficiency, oral cyanocobalamin doses approximately 50 to 150 micrograms once daily are commonly used, and many over-the-counter products contain 250, 500, or 1000 micrograms. Larger oral amounts are used because only a small percentage may be absorbed through passive diffusion. Vitamin B12 is generally well tolerated, but some people may experience nausea, diarrhea, headaches, itching, or acne-like skin reaction. People with a known cobalt allergy or previous allergic reaction to vitamin B12 product should seek professional advice before use. Treatment duration depends on the cause, and person with temporary dietary deficiency may eventually maintain normal levels through input food intake or supplementation. A person who cannot absorb vitamin B12 because of autoimmune gastritis or maybe digestive surgery may require lifelong replacement. Energy can improve within several weeks, but neurological recovery may take for several months. The most important rule is this: to not only replace vitamin B12, find out why it becomes deficient, and this is why part of my practice when I work with the patients in my MarioLab protocols with nutrition and natural remedies. If you want to learn a lot more about vitamin D deficiency, watch my video right here in this little box. Thank you for following me. See you in the next video. Bye bye.